ready to set up your Portal Pro, all you have to do is reach under the seat and lower the chair out to the side. Next, release the cam locks and raise the head face cradle into place. Release and lock the cam locks when you lower the armrest into place. Next, look at the Z-clip. And you want to make sure that the Z-clip is in place and also that the band and the cable is quite taut. From here, what you'd like to do first is to demonstrate and show the client how to actually sit in the chair, where to place their arms, and where to place their legs. And as the client's sitting down, of course, you want to make sure that you give some support and guidance when they're sitting down. Next, what you'd like to do is release the cam locks so you can adjust the face cradle. The client should be quite comfortable in this position. And you're also going to inspect and have a look at to make sure that their arms are at a height level by adjusting the armrest. You're going to have options of both releasing the cam lock and pulling on the strap in a moment. From there, you're ready to work. You also have the ability to change the height of the chair for both the client and yourself. So the first thing you'd like to do if you're going to change the height is you'd like to put a little slack in the cable. Narrow the base, putting a little bit of slack in the base. The next thing you like to do is take out the Z-clip. From here, you can either put it in the lower level or higher level holes. If you put it in the higher level holes, you notice that the base is going to be narrower and the chair is going to be higher. If you go into lower base, lower holes, it's going to be a wider base and lower. So what you want to do when you do put the hole in is make sure that the cable is taut and you want to lower the chair down. Next, if you want to raise or lower the seat, you just have to depress the silver button to change the angle. Keep an eye on client's comfort, especially for the legs and the knees. Sometimes the client can also put their legs out to the side for comfort, or they can extend their legs out in front. When they do that, sometimes the lower back increases the lordosis or the curvature in the back. So what you'd like to do at that point is to depress the silver button and lower the seat to help bring the lower back into alignment. But remember, you should always adjust it with the client off the chair. Next, what we want to do is adjust the chest pad so the top of the chest pad is just below the clavicle. We also have the option of raising or lowering the height. You can turn it sideways for wide-breasted individuals. Next, you can interchange the chest pad with a sternum pad. The sternum pad is quite adaptable. You can use it for pregnant women, men with large abdominal areas. You can also adjust the height. You can raise it up or lower, or even ask the client to help you. In addition, you can change the angle by making the go from horizontal to vertical. Also, allowing for large-breasted individuals, or you can put it in a vertical position to also aid with lengthening, stretching out the arms. It gives individuals a longer reach, greater reaching distance. When you're ready to adjust the face cradle, what you'd like to do is loosen the dowels, and then if you can, it gives you the ability to elongate for taller people or shorten, lower down the face cradle for shorter people. When you release the first cam lock, you're able to take the head forward and back, and if you release the second cam lock, you're able to adjust a little bit higher up on the neck. If you release both cam locks, you're able to take both angles at the same time for better comfort of the client. And as the client lowers their face down, you can adjust it slowly to the best angle and comfort for the client. So the next thing you'd like to do, and you actually have a great option to do, is to widen or narrow the face cradle to adapt to the client's face. Notice it's as easy as just separating or bringing the ends of the face cradle together to adapt to the client's face. The top of the face cradle, on the inner side here, we want to adapt to just above the eyebrows. And you have the option to lower or raise the face cradle to match the forehead of the client. The next thing you'd like to look at is the height of the armrest. When you're setting up the armrest, try to make sure that the base of the armrest is at about the height of the client's hip for best comfort. If you'd like to raise or lower the armrest, just hold on to the strap and pull down on the strap. If you want to lower the armrest, all you have to do is release the buckle and lower it down to the desired height. Next, if you want to change the angle, all you have to do is release the cam lock, adjust to the angle you prefer, and then relock the cam lock. When you're ready to turn the client around and work on the anterior portions of the body, what you have to do is adjust the height of the chair and make sure that the cable's in place as mentioned earlier. In addition, you want to lower or raise the seat so it's a comfortable position for the client to allow them to put their feet firmly on the ground. After the client sits down, you just want to confirm that their feet are comfortably on the ground, and then have the client sit back in the chair. Next, what you'd like to do is support the cervical area by taking the face rest and turn it around 180 degrees and putting it back in place. Next, you'd like to release the cam locks and adjust the face cradle housing so it's comfortable and it matches the back of her head. From this position, you're able to work on the masseters or the temporalis muscles. In addition, what you can do is interchange the face cradle with the sternum pad. This will fit comfortably in the cervical area. You can place it right on the housing and ask the client to sit back. The next thing I'd like to do is show you how to fold up the chair. First of all, release the cam lock on the armrest, lower the armrest and lock the cam lock back in place. Next, I'd like you to tighten the knobs, release the cam locks on the face cradle, and then tighten the cam locks on the face cradle. Next, what we'd like to do is to confirm to make sure that the silver button is in the third position from the bottom. Tilt the chair back, close the seat on itself, tilt the chair forward, and away we go. Next, if you like, you can use your shoulder strap and attach it to the D-ring below and above. And very easily, you put the shoulder strap over the shoulder, make sure that the cushion, the seat's on the hip, and away you go. Alternatively, you can use the bag, holding onto the straps, or you can reach down and use the shoulder strap and the handle to carry the bag. Hi, and welcome back. Here you have your client sitting in the chair. It's time for you to work. Just a few reminders that you can keep in mind. Remember that when you set up the chair, you set it up for your own comfort and then adjust it as the client comes and sits down. And as you're working, you want to make sure that your shoulders and your arms are just below your shoulders. Relax as you're moving from side to side, using your body as one unit as you work. Very easy, always breathing, never holding your breath, of course. And as you work around the body, same thing, you want to move your body as one unit, feet slightly greater than shoulder width apart. And as we're working, we want to use the legs. Use the legs as you're working. Yes, even if you're working across the back, 45-degree angle, using the body, rather than just the arms, use your body. Save your arms, save your wrists, safety first, okay? In addition, we can also use the saddle stool. Now, I sometimes like to use this when I'm either working in a low back area, here, very easy over the ribs, or over the kidney area. In addition, when I have the person turn around, I sometimes like, if I'm using joint mobilizations, for those of you that are familiar with joint mobilizations, we can use this from this position, very comfortable for the client to be in this position. Also the therapist supports the back, very comfortable in this position. And of course you can just stroll your way right around to the other side, work on the arms in a comfortable position. There. There's a self-care exercise that I'd like to share with you, which is both I find very effective for both yourself and the client. For example, what I'm going to do is just turn sideways so you can see the motion. I'm going to lower my fingertips on top of the shoulders, shortens the lever, okay? Bring the elbows through to the front in front of the chest, and bring the chin to the chest. As I do that, I'm going to lengthen the muscle in the cervical area. I'm going to lengthen the muscle between the shoulder blades. As I lift up and open up out to the side, we bring the head back to a horizontal plane, chin to the chest, back through to the front, and one more time, and lift. And then I like to reverse direction. We bring it forward and lift. Notice as we're bringing it forward, down and up, we're opening up the pectoralis area, lengthening the latissimus dorsi, subscapularis. Very easy exercise. The next thing I'd like to do is take it down to the lower back area, the lumbar. I'll turn sideways so you can have a look at me. So what I'm going to do is slightly bend the knees. I'm going to immediately rotate the shoulders. Same time as I do that, bring the chin to the chest, bend the legs. As you slowly start to straighten out the legs, open up the chest area, lateral rotation of the arms. Very easy for clients that can't lift their arm above the shoulder. If you want, or for yourself, you just bring the arms in front of the chest, exhale, inhale, open up the chest. Okay? These exercises are appropriate for most people, and they can be done before or after any activity. Enjoy.